Ever wondered what that loud snapping or popping sound is when you get up from a chair, walk, or swing your leg?
Today, we are diving deep into a very common but highly misunderstood condition known as snapping hip syndrome. In the medical world, we call this SUNS. Let's break down exactly what is happening inside your joint.
The history of this condition goes way back. It was first officially documented in medical literature in the mid-19th century. Often noted in dancers and athletes who performed highly repetitive hip flexion movements. They called it dancer's hip.
Today, we know it affects a wide range of people, not just dancers. Runners, weightlifters, and even everyday walkers experience this.
To understand the plot of what's going wrong, we have to look at the anatomy. The hip is a complex ball and socket joint, surrounded by thick bands of fibrous tissue. When these tissues get excessively tight, the stage is set for a snapping hip. Orthopaedically, we classify Coxa Saltans into 3 distinct types, depending on where the snapping occurs. First, we have external snapping hip. This is by far the most common type we see in practice. It happens when the thick IT band or the gluteus maximus tendon snaps over the greater trochanter of the femur.
You can often actually see the muscle bundle physically rolling and popping under the skin when this happens.
Next is internal snapping hip. This involves the iliopsoas tendon, your primary hip flexor snapping over internal structures.
Usually, it snaps over the iliopectineal eminence on the pelvis, or sometimes over the head of the femur itself.
People with the internal type usually feel the pop deep in their hip, especially when getting up from a deep-seated position. Finally, we have intra-articular snapping hip. Unlike the first two, this one doesn't involve tendons on the outside. This is a mechanical issue inside the joint itself, usually a labral tear, a loose body of bone, or damaged cartilage getting caught. Intra-articular snapping is less about tightness and more about structural damage, which often requires a closer look with an MRI. External on the side, internal in the groin, and intra-articular deep inside the socket. Those are your 3 classifications. Now that we know the types, what does this actually feel like? Let's talk about the clinical symptoms. The most obvious symptom is the audible or palpable snap. You can hear it, and you can definitely feel it. Often, it doesn't hurt at first, but over time, the constant friction causes inflammation, leading to a dull, aching pain. This inflammation frequently leads to bursitis, swelling of the small fluid sacs that cushion your bones and tendons. You might also experience muscle weakness, especially when trying to lift the leg forward or out to the side.
But here is where most people get it completely wrong. Are you ready for the twist?
The twist! When people hear that loud pop, they immediately panic. They think their hip is dislocating or their bone is chipping. But for external and internal snapping hip, your bones and joints are perfectly fine. It's completely extra-articular. It is literally just a tight tendon, snapping across a bony bump, exactly like a thick rubber band plucking over a guitar fret.
Because it's a soft tissue issue, conservative treatment is highly effective. It starts with rest, ice, and modifying your activities. Physical therapy is the gold standard, stretching out the IT band or iliopsoas, while strengthening the core and glutes, fixes the imbalance. If the pain from bursitis is severe, we can use a targeted corticosteroid injection to rapidly bring down the inflammation. Surgery is rarely needed. We only consider arthroscopy if conservative treatments fail for months, or if you have an intra-articular labral tear. With the right mechanics and a little patience, almost everyone returns to their favorite activities, completely pain-free.
So if your hip is snapping, don't panic. You aren't breaking any bones. It's likely just a tight tendon asking for a break. If you found this breakdown helpful, make sure to hit that subscribe button to join us here at Shanorthohub for more orthopedic insights.